if that's the case, that's when an individual might be appropriate or might benefit from the services that Capital Hospice provides.
That's interesting. So it's just not cancer anymore. It's any terminal illness.
That's a very important point. It's any illness. It's also any age. People often think it maybe only applies to seniors, but it's individuals of all ages that we support. And we've been doing this for over 30 years.
Well, that's wonderful. So what about health insurance? Do they have to have health insurance, or is there some plans where you work with health insurance, or if they don't have health insurance at all, is there some services that you still provide?
Well, people might be surprised to know that all of our services, that includes all the staff visits, that includes medications, supplies, and equipment, all of that is covered by Medicare and Medicaid 100%. And most health insurances have a hospice benefit as well. And the good news is an individual who doesn't have insurance, not eligible for Medicare or Medicaid, gets the same level of care. And we do that through generous donations from the community.
That is wonderful. Is there anything else you'd like to share, information you'd like to share with us tonight?
I would like to encourage individuals to go to our website, www.capitalhospice.org, or give us a call on 1-800-869-2136. And we'd be so glad to give you a talk. If appropriate, we'd send out a nurse to kind of assess the situation, and there's no charge for that at all.
As someone who's actually had their father use your services, I can highly recommend this group.
Hi, Angela Dawkins again. I'm here with Paul Turley. Am I pronouncing it correctly?
Yes.
He's a marketing and account manager for the Community Radiology Associates. And could you tell us a little bit about what your organization does?
Yes, our organization provides radiology services. We cover the whole spectrum from PET-CT, CT, MRI, mammogram, sonograms, fluoroscopy, and X-ray. And our Bowie radiology site specifically, we do X-ray, we do fluoroscopy, we do sonogram, mammogram, we have an open MRI, and a CAT scan.
Where's your Bowie site located?
The great thing about our Bowie site is it is right here where the health center is. We are right next to it on the first level, and a lot of our exams, you can come in for a walk-in. You don't necessarily have to schedule an appointment.
What are some of the indications for your services?
Well, the thing that we're focusing on right now is that since it's Breast Awareness Month for October, that we want patients, women as well as men, to focus on, doing self-examinations, paying attention to any discomfort, any pain, or any lumps or nodules that they feel in their breast, and make sure that they go see their doctor to pursue any tests that they may need to do in regards to the issues that they may be dealing with.
What sort of things are they looking for when you say self-examinations? What kinds of things are they looking for?
They want to, if they're feeling any unusual pain or any unusual discomfort, if they feel hardness in the breast, if they feel what they think is a lump, anything like that that is out of the normal, they definitely don't want to wait. Definitely go see your doctor.
So it's typically the doctor who's referring the individual to you, or are there circumstances where the individual will come directly to you?
Well, we definitely have two circumstances. A lot of the women, they have their yearly routine mammogram, and they can come in without a referral on their own, as long as it's been the year cycle, and as long as they know who their doctor is, so we can send that report. The patients that have the sensitivities, the issues, the lumps, they'll have a diagnostic mammogram, which they'll need to go see their doctor to discuss it, get a referral, and the referral should not only have for a diagnostic mammogram, but it should also include the possibility of a breast sonogram, because that may be needed.
Are there any hints or suggestions that you can give to our audience?
Just ultimately pay attention to your body and how it feels. If you have any pain, anything that is not normal, you really should not wait. You should really pursue it because the longer you wait, obviously, the worse it could get. You may not need to get a test, but at least you and your doctor can manage that pain, that concern that you have.
Hi, I'm here with Katie Huffling of Dimensions OBGYN Associates. Can you tell us what the services your organization provides?
So we're a practice comprised of physicians and midwives, and we provide care for women all through the life cycle. So from teenagers coming in for their first GYN exam through women past the menopause years and everything in between.
Are there any health concerns that people should immediately see you, or just?
Well, we try to stress, healthy living and trying to come in before you have a problem. One of the things that we talk to our clients with about pretty frequently is doing a self-breast exam at home. That's one way that you can monitor for any problems before they become really serious.
And should everyone see you once a year?
Definitely. We recommend an annual GYN yearly.
And how about mammograms?
For women 40 and over, depending on your history, it could be between 1 to 2 years you should have a mammogram.
Are there any other areas that we should be concerned about that you'd like to share with us?
Well, one area that's near and dear to my heart is during pregnancy, there's a lot of environmental exposures that you need to watch out for. One of them that's been in the news pretty frequently recently is the mercury in fish, and just looking at what types of fish you're eating, because it's really good to eat fish when you're pregnant, but you need to watch that you're eating fish that are low in mercury.
Can you tell me your name and the name of your organization, please?
My name is Corey Marshall, and I'm a volunteer with the National Kidney Foundation of Washington, D.C.
What kind of services do you provide?
We are a not-for-profit organization, and our whole goal is to bring awareness to kidney disease, especially here in the nation's capital, where we have the highest prevalence of kidney disease. And we go out to different venues, health fairs, whoever will have us, churches, different organizations, and we spread the word. We want to get the word out that we can control kidney disease, and we want to fight it.
Can you give us some symptoms that people can look for?
I would definitely start with our family history. If you have a family history of high blood pressure, cholesterol issues, chronic kidney disease, that's a sign, because it could be hereditary. So I would say start there by going to your local doctor and just having simple blood tests done, and it'll test your blood levels and see what your creatinine is at. And your creatinine is a simple measurement of how well your kidneys are functioning, and that kind of gives us our start for whether or not we need to go further in the diagnosis.
What might be an indication that there's a problem with your kidney?
Urinary tract infections, high blood pressure, family, could be hereditary, but the main, for what we've been seeing here in the Washington, D.C. area as far as prevalence has been high blood pressure and urinary tract infections.
So if you have a urinary tract infection, would you suggest that someone go to see their physician, or should they immediately go to your emergency room?
I would make an appointment to see your physician. If it's a serious infection where there's pain involved, I would definitely go to the emergency room. But if you have a feeling that it's on an onset and it's coming aboard, I would definitely make an appointment with the doctor and have it treated immediately.
Do you have any hints or suggestions of how to keep a good kidney?
Well, my son, he's an 8-year-old who was just transplanted, and for him, there were no warning signs. I mean, he's 8 years old. He didn't, drink. He didn't live, a lavish lifestyle. Well, he ate fast foods and all that sort of stuff. So some instances, it just happens. And then some instances, if you're eating high greasy foods and not taking care of your body, drinking, drugs, that could lead to it.
Do you have a location where people can go to and find more information about this?
Yes, I would go to www.nationalkidneyfoundation.org for more information.
Well, great. Thank you very much. Good afternoon. Could you tell me your name and the name of your organization, please?
Yes, I'm Dr. Scott Campman. I'm with the Total Wellness Chiropractic Center of Bowie and Crofton.
And I've always wondered what a chiropractor does. Could you explain a little bit about what your function is?
Sure. We relieve the normal stress and pressure in the spinal joints to take the pressure off the nervous system so the body can relax and take care of itself.
In layman's term, exactly what are you doing?
Relieving the pressure on a nerve, take away pain and numbness, tingling, and burning sensations that people may have, or headaches, things like that.
What are some of the indications that I may need a chiropractor?
Pain, headaches, numbness, tingling, burning sensations in the extremities, hunched posture, having fatigue more often, like when people sit at a computer for too long.